Hello everyone, welcome to another episode of TooHealthTalk, a show where we talk about real health challenges in a very simple and honest conversation. For you to know what we're doing here, please like, share, and subscribe. On today's episode, we have a very special guest. This guest is going to teach us a very important and an essential discussion, like topic today. So I'm so excited to have this guest with us today, the person of Mr. Emmanuel. Welcome, sir.
Thank you very much for having me.
Yeah, Mr. Emmanuel is an expert in emergency and first responders cases. It's not easy to get Mr. Emmanuel to be on the show today, but because of his busy schedule, but I'm very excited to have you here, sir.
Thank you.
Welcome very much.
Thank you.
Also, Mr. Emmanuel works with Ambulance Academy. They get to train people on first responders, on emergencies, and the rest. So I'll give it up to Mr. Emmanuel now. Welcome, sir.
Thank you very much.
So, how is it like being a first responder?
Yeah, it's a good work to do when it comes to saving lives. Always encourage everybody to be in the full support of emergency responders, because usually when emergency happens, we are the first people to give the immediate care before advanced medical aid is being given, which helps to save lives. So it's a thing of joy doing it with other cool responders on field.
But in Nigeria, most people die before they even get to the hospital. Like, what's the reason?
Yeah, the main reason for that is most times because of the first responders who go in might not have the needed knowledge to go into to save lives, and then panic also contributes a lot to that. Something happens because I don't have the right skills, then there's nothing I can do. The next thing is shouting becomes the order of the day. Another thing is why instead of going in to respond, most people go with the phones to be the first to post when people's life is in danger, and the space of someone surviving is just in few seconds or minutes when it has to do with emergencies, and having the right skills will do that. So the basic thing, or why most times people die before even the arrival of an ambulance or an advanced medical care, is because the people where the first responders did not know what we call basic life support, the skills needed at least to sustain that person's life pending when advanced aid will come.
So, like, what's the average time for response in Nigeria?
Yeah, so when you talk of response, it's in two ways: the medical response or the general response. For Nigeria, it's rapid. I would say it's rapid in the sense that as quiet as an environment is, once there's, let's say, a road crash, in space of minutes, you see people rushing in to view what has happened or even trying to assist. But for the ambulance services, we always say when you don't activate an emergency ambulance to arrive, it will take a lot of time for that to happen. And it's good that people should know that we actually have an emergency line, which is 112 for Nigeria, for people to call when there's an emergency. And like I said, most people don't even know that we have an emergency number to call.
So like, what's the basic skill now that someone needs to like get to know for?
So for we always advise at least basic first aid skills should every Nigerian should have that. The problem most people feel is when you talk of first aid or basic life support, they feel it's a medical line thing. If I'm not, if I don't have a medical background, I can't learn basic life support. No, basic life support is for all phases of life, because basic emergencies like choking could happen, and you don't actually need a medical doctor to control choking for somebody. You can actually resuscitate before taking the person to the nearest medical facility if there are complications due to the assistance.
So, but you also talked about the emergency number in Nigeria. Does that number work? Like, is it...
Yeah, for we are in FCT, so for FCT it's kind of used it more than 15 times. Wow. It has actually worked for me, but the only problem most times is the response time. It might not be as quick as it should be, but they always respond. The only another issue is I had a training where someone said when he called the line, It was music that was playing before someone, while an emergency number is supposed to go through at the same time. So it's more of advocacy. The more we talk about it, the more those in charge of the 112 will also build up capacity to be able to respond fast when emergencies come.
So, like, is the government playing a role in this your sector now in emergency services, medical emergency services?
Yes, yes, yes. We currently have the NEMA is there, but currently we have an national emergency medical services and an ambulance system called the NEMSAS. Also have FCT MSAS with other organizations partnering with them, like Ambulance Academy doing that. So with them, where ambulances could be collated on the network for easy and fast response. So the private and the government sector coming together to do that. But the government is actually building up those ambulance systems. It's actually in existence. FCT also have FCT MSAS that their key role is emergency medical services and ambulance systems.
So, what is the common knowledge now, like for every adult now? What's the common knowledge that they're supposed to know, emergency knowledge that they're supposed to have?
I always advise people CPR should be, many people have died because of absence of CPR on an emergency. And then people feel when you talk of basic life support, you need gadgets to work with and all. Sometimes even what you say matters. Imagine someone suddenly collapse in an office, and the next thing that is coming out of a colleague's mouth is this how you are going to leave us? So now when someone says that, one funny thing that happens in emergencies is the last organ that goes out of a dying man is the hearing organ. Wow. So what you even say around the casualty matters. So we always say words of reassurance, which anybody well trained can actually do that without gadgets. And CPR, you just need your hands. And another thing is the rightful usage of CPR, because some people just watch on movies, and when they see someone collapse, you go and compress, not knowing that it's not everybody lying that way that you compress. There are some casualties that we term them casualties unconscious still breathing. You don't place such casualties in recovery position. You don't compress such casualties. Rather, you place them in what we call recovery position. You're only meant to compress the chest of someone who is unconscious and not breathing. And it's something everybody should know, which is CPR, cardiopulmonary resuscitation. When the heart stops working, which is this primary aim of pumping blood around the system, you need to come there now manually at the center of the casualty's chest, using the heel of your palm to compress up to 30 times, and then giving 2 rescue breaths for resuscitation to take place.
So you can show us like a little demonstration.
Yeah, so what I mean is like this mannequin here, just at the center here, where you go with your hands this way, up, go closer to the casualty, lock your joints, and then you push in your body up to 30 times while monitoring the body system. Thus, you do this when the casualty you have discovered is unresponsive. There's no pulse, and then there's no response at all from the casualty, to try as much as possible to keep vital organs active pending when advanced aid will come. CPR has saved thousands of lives around the globe, and it's something everybody should know.
So what about pouring some water when the person faints?
Yeah, people do a lot of things. Pouring water, fanning. The last one I saw was even the slap. But then in the class, someone was saying, even if there's a slap you give somebody that can resuscitate. No, you don't do that when someone faints. Most times, what will turn fainting is lack of oxygen-rich blood in the brain. Once there's not enough oxygen supply blood in the brain, it causes people to feel dizzy. If nothing is done, they go into fainting. Now, fainting is different from unconsciousness, because when I faint from afar, I could visibly see my chest rising and all. So what you need to do is you just go low at the legs, lift up the legs up to the chest level, just to allow for rapid flow of oxygen with blood from the lower part of the body to the brain to restart circulation. So normally fainting in the space of a minute to 2, someone is supposed to recover. The ones I've handled, in most cases, once the leg is elevated down, with the next thing you hear is, why am I here? What happened? Then you know that recovery has taken place. Place the person in a comfortable position and ask why the person faints. And
So you were talking about the difference between fainting and someone being collapsed. So
the difference between fainting and unconsciousness. Unconsciousness, usually the body system is silent. But for fainting, you could see from afar that there are still body movements and all. So you know this is what you are going to do. But there's actually what we call fake fainting. So that this might not actually help. That's lifting up the legs might not, the person might not recover. What I call fake fainting is maybe someone hits somebody's car on the traffic light and knows that he's at fault. The next thing he faints. Maybe the car is, let's say, Mercedes Benz. Someone came with his car and bashed at the back. The person may feel, if I should come out here, this person will hold me to pay, or the law enforcement agencies will hold me. So most cases, the ones I've seen, the person responsible for that hit just faints, goes into what we call a fake fainting. So if you lift up the legs, the person might not recover. Don't fully aware that if he opens up his eyes, he will pay for that this thing. But when he's unconscious, then the body is silent. Then you need to carry out checks, like eliciting for response from the person, if the person is responsive, opening up the person's airways, then checking for breathing, if the person is breathing or not. At that level, that's when you know whether to compress or not. If the casualty is not breathing, there's no pulse, then you commence CPR.
So what about accident victim? Like someone is involved in a car accident. Now, how can someone help?
Yeah, basically, what we do in road crashes is you have to assess the environment. Many people have actually died from trying to assist people during road crashes. A car has a crash, and then you are going, you're not even checking for your safety. We always tell you, for you to save a life, you need to be safe first. So when there is a road crash, the first thing a responder needs to do is check the environment. Is it safe? This thing happened on an express, maybe at the middle of the road. Is it not safe for me to move this person to a safer location before attending to the person? Some people are at the spot working with the person, feeling since there's an emergency, any incoming car should know that there's an emergency. It's not everybody that will see, especially a bend. An incoming car will not know what has happened and will end up coming in and smashing you and those involved. So in most cases, you check. And if the ignition of the car is on, you need to turn it off because some impacts may ignite fire. And when the engine is still rolling, it could amplify that. So you have to turn off that. Don't go inside the car trying to evacuate casualties. We always advise, if you're evacuating casualties outside, stay at a safe distance. That's outside, and try pulling the casualties out. But even in evacuating casualties outside, you need to note the body system. If there are fractures, you will not need to drag someone from where it's having fracture because you complicate the issues. So in most cases, if the environment is safe for you to immobilize, then immobilize the person before pulling the person out. Immobilization means the affected part should be held still, so the bone doesn't move inwards and cause further damage to the body tissues.
Wow. So what about bleeding patients?
Now for bleeding, there's what we call major bleeding and minor bleeding. I'll take the major because that's the one that is life-threatening. We always tell you direct force pressure should be the first thing you need to do. So I have someone bleeding here, maybe because of an impact from an accident. The next thing is what? I'll get a pad. The funny thing is, people don't know that why people shy away most times from helping is because they feel if I don't have a first aid kit around, then I can't save a life. For bleeding, someone's clothing can be improvised. The only issue is infection. But is it better if someone is bleeding? Is it not better I stop that bleeding and the doctors find a way of treating infection if there's an infection after that, or just saying because I don't have a first aid kit, let this person just bleed out. So someone's shirt could serve as that. Just form a pad with it, apply direct force pressure on the. So let's say it's here, the person is bleeding. I will not keep this hand down. The reason is because if the hand is downwards, you fight with more blood. When the hand is elevated this way, you fight with less blood. So I pad and then I bandage. And I'm not going to, after bandaging, leave this hand downwards. I have to keep this hand stabilized upwards so that more clotting will take place and then the bleeding will stop. And then I'll evacuate to the nearest medical facility. And another mistake again some people do is embedded objects and then bleeding. Maybe something got stabbed in someone's hand or laps. You are not expected to pull that off. The damage has already been done. So what you do is you pad around the object, not touching the handle or of that, and then you pad around and then you bandage with the roller bandage, and then you take to the nearest medical facility. Do not remove. If you remove that object that has been embedded, the volume of blood that will come out, the casualty might not survive that.
Wow.
And then another major thing is bleeding could be internal or external. So when it's internal, most times you see people asking of water, feeling taste. That's the major thing. Or bleeding from openings of the body. You should suspect that someone has internal bleeding. And at first aid level will tell you that's a critical emergency situation that needs to be addressed in the nearest medical facility. But do not give water. If you give water, you might distort circulation and it might shut down the casualty system.
Wow.
So the mistake most people do is when someone is asking for water, they start doing water and leave. It could be dangerous for the casualty doing that.
Wow.
When it comes to bleeding.
So lastly, you've already like touched a lot of places. I wanted to even ask you questions on. You've touched them so well. So, but lastly, before we go, I want you to. Have you ever experienced any touching story you like to share when evacuating a patient?
Yeah. I have. There was a casualty I was actually we were evacuating on field, and from all indications, it looks like he was about giving up. So what I did was that reassurance that if he could keep himself strong, I could take him to the hospital. He's definitely going to survive. And although he wasn't reacting to what I was saying, but when he recovered at the hospital later on, he said it was actually those words of reassurance I gave him that made him to fight. He was fighting with his life, or because he was almost giving up, according to him. But those words of reassurance kept on building his immune system until he was able to receive advanced care. So when we carry people on field, it's always important. I always said this: don't stay silent with the casualty. You will feel the person is not responding to you, but the person can actually hear what you are saying. So you keep on reassuring that person until advanced. We call it PSS in first aid, psychosocial support first aid. It's something people should learn to do. When your hands cannot do anything, your mouth should be able to say something that will encourage that person to fight with his or her life. So we don't end up losing people because people kept them silent while transporting them to the nearest medical facility.
Wow. So on a general overview now, what's the advice to those that have not gotten, maybe that are scared to give first aid in an incident scene?
I would say it's very good. It's something everyone needs to know, that basic life support is needed at every phase of life. So you must not be a medical personnel, like I said earlier, or have a medical background, as I said earlier. You can actually save lives by trying as much as possible to learn these basic life saving skills. The problem is you don't even know whether it's in your house that you need these basic life saving skills to apply on. So I advise Nigerians to learn about get skills on basic life saving skills, so we can save more lives together when emergencies happen.
Okay, thank you very, very much, Mr. Emmanuel, for coming on the show. And at this junction, we'll wrap it up here. I want to especially thank you for watching up to this moment. If you have any questions, you can drop the questions in the comment section. It will surely get to Mr. Emmanuel. Also, as we're about to wrap up the show, I would like to thank Mr. Emmanuel also for coming on the show once again.
Thank you very much.
Also thank you, the viewers, for watching up to this moment. And for you to support what we're doing, please like, share, and subscribe to this channel. Thank you very much. See you in the next episode. Bye.